If you are over 60, the first drink you take in the morning may be doing more than waking you up. It may be helping your body recover from the night before, or it may be making your kidneys, your blood sugar, your stress hormones, and your cellular repair systems work harder than they need to. And the surprising part is this: the problem is usually not the water itself. It is what is missing from it when you drink it, and whether your body is the right body for this routine in the first place. This is not about expensive bottled alkaline water. It is not about a detox cleanse. It is not about a miracle drink that cures disease. I do not want you to hear that, because that is not how real medicine works. What I want to show you today is a simple, evidence-informed morning routine built around three ordinary compounds: water, fresh lemon for citrate, a very small amount of bicarbonate in the right person, and magnesium when it is appropriate. Used carefully, these may help support hydration, kidney workload, urinary chemistry, energy metabolism, and the normal repair signals your body already uses every morning. But I need to be clear from the start. This routine does not cure cancer. It does not reverse kidney disease. It does not replace medication, chemotherapy, dialysis care, blood pressure treatment, or your doctor's advice. In fact, there are people who should not do this without medical guidance, and that may be the most important part of this entire video. So stay with me until the end, because I am going to show you the routine, the science behind it, the mistakes people make, and the warning signs that tell you this is not for you. Before we begin, subscribe to Dr. Caleb Rowan if you want practical, science-based health guidance for aging stronger after 60. Let us begin with what happens before your feet even touch the floor in the morning. While you sleep for 7 or 8 hours, your body is not inactive. You are breathing out humid air. You may be sweating lightly under the blankets. Your kidneys continue filtering blood. Your bladder continues collecting urine. Even if you never wake up thirsty, your body has still spent the night losing fluid. For a younger person, that may be easy to correct. But after 60, the thirst signal often becomes less reliable. The kidneys may respond more slowly to shifts in water and electrolytes. Blood pressure regulation may be more sensitive. And the morning can become a time when your body is quietly asking for support before coffee, before breakfast, and before the stress of the day begins. Most people think of dehydration only as something dramatic: dizziness, dry lips, heat exhaustion, or needing an IV. But there is a milder form that matters in daily life. You can wake up just a little underhydrated, not enough to feel sick, but enough that your blood becomes slightly more concentrated and your body has to adjust. That adjustment involves hormones. It involves the kidneys. It involves your blood vessels. It may influence how hard your heart has to work. And in older adults, those small daily pressures can add up over time. Picture your body as a filtration system that has been running all night. The filters have been doing their job. The pipes have been moving fluid. The pressure system has been adjusting while you sleep. Then you wake up, and the first thing you pour in is coffee, or you swallow medications with 2 tiny sips of water, or you skip fluids entirely until mid-morning. That does not mean you have harmed yourself in one morning. But if that becomes your pattern for years, your body begins each day with one more unnecessary burden. And that burden is not only about thirst, it connects directly to the morning stress system. Cortisol often gets a bad reputation, but cortisol itself is not the enemy. You need cortisol. It helps you wake up. It helps mobilize energy. It helps your brain become alert. It helps your immune system prepare for the day. Your body naturally produces a rise in cortisol after waking. Researchers call this the cortisol awakening response. That response is normal. The problem is when the system is already under strain, when the cortisol rise begins. When you wake up underhydrated, your body may release more vasopressin, also called antidiuretic hormone. Vasopressin tells the kidneys to hold on to water. That is helpful in the short term because your body is trying to protect blood volume. But vasopressin also communicates with the stress system. In some people, especially people who habitually drink too little fluid, this may be associated with a stronger stress response. So now the first hour of your day is not just a gentle wake-up signal. It may become a stronger hormonal push than your body actually needs. This is one reason some older adults wake up feeling strangely heavy, dry-mouthed, foggy, jittery, or already tense. It is also one reason morning blood sugar can be confusing. I have heard patients say, "Doctor, I ate nothing all night, but my glucose is high when I wake up." There are many reasons that can happen, including the dawn phenomenon, insulin resistance, sleep quality, medications, and liver glucose production. But morning stress hormones can be part of that picture. When cortisol rises, the liver can release more glucose into the blood. That does not mean a glass of water will magically fix diabetes. It means hydration is one pressure point that is often ignored. This is also why coffee first thing can backfire for some people. Coffee is not bad by itself. Many people tolerate it well, and coffee contains compounds that have been studied for metabolic and liver health. But if your mouth is dry, your urine is dark, your head is heavy, and your first move is a strong cup of coffee before water, you may be asking your nervous system to accelerate before your fluid balance has caught up. The first goal of morning water is not to create a miracle. It is to reduce unnecessary stress on the system. It is to give your kidneys fluid to work with. It is to help your circulation start the day in a more stable state. It is to give your body a cleaner beginning before food, caffeine, and activity enter the picture. But this is where many people stop. They think the entire answer is simply drink more water. And for some people, that alone is a major improvement. But after 60, water alone may not address the second problem, which is mineral support, especially magnesium. Before we talk about magnesium, we need to understand the special window that opens after a night of fasting. When you sleep, you are not eating. For most people, that means there is an overnight fast of 8, 10, sometimes 12 hours between dinner and breakfast. During that fasted period, your cells shift their priorities. They are not focused mainly on digesting new food. They are not flooded with a fresh supply of amino acids, carbohydrates, and calories. Instead, they begin leaning more heavily into maintenance. One of the key signals involved is AMPK, which you can think of as an energy sensing switch. When the cell senses lower energy availability, AMPK tells the body to become more efficient. Clean up damaged parts, recycle what can be reused, improve energy handling, support normal repair pathways. On the other side is mTOR, a growth and building signal that rises when you eat, especially when you take in protein and carbohydrates. mTOR is not bad. You need mTOR to build muscle, heal tissue, and maintain strength. But AMPK and mTOR are like two different work crews. One is the cleanup crew, the other is the construction crew. At night, while you are fasting, the cleanup crew gets more time to work. Cells can engage in autophagy, a process where damaged proteins, worn-out cellular parts, and dysfunctional components can be broken down and recycled. Autophagy is not a trendy wellness word. It is a real biological process, and it has been studied for its role in aging, metabolism, neurodegeneration, immunity, and stem cell maintenance. But it is also not magic. You cannot turn it into a guaranteed anti-aging switch by drinking one beverage. The honest way to say it is this: your overnight fast creates a natural opportunity for cellular maintenance, and your first choices in the morning can either respect that window or close it quickly. Breakfast is not the villain. I do not want anyone afraid of breakfast. Older adults especially need adequate protein to preserve muscle, but the timing matters. If you wake up and immediately eat a large meal, the body shifts quickly toward digestion and growth signals. That may be fine for some people, especially those with low blood sugar risk or specific medical needs. But if you are generally healthy and your doctor has not told you to eat immediately, giving yourself 20 to 30 minutes after your morning water can allow that fasted transition to continue a little longer. This is where magnesium becomes important. Magnesium is not a sleeping pill. It is not an anti-cancer mineral. It is not a magic relaxation powder. Magnesium is a working mineral. It participates in hundreds of enzymatic reactions. It helps with muscle and nerve function. It is involved in glucose metabolism. It supports normal blood pressure regulation. It is needed for the ATP system because the energy currency your cells use is often handled as a magnesium ATP complex. In plain English, magnesium helps the energy machinery run more smoothly, and many older adults do not get enough of it. The reasons are practical. People eat fewer magnesium-rich foods. They may avoid seeds, beans, leafy greens, and nuts because of digestion, dental problems, cost, habit, or appetite changes. Absorption can change with age. Long-term use of proton pump inhibitors for acid reflux may lower magnesium in some people. Diuretics can increase urinary magnesium loss. Diabetes, alcohol intake, and certain gastrointestinal conditions can also affect magnesium balance. When magnesium is low, the symptoms are often vague. Muscle cramps, twitching, restless legs, poor sleep quality, a feeling of tension in the body, blood pressure that is harder to control, glucose that does not respond as well as expected. None of these prove magnesium deficiency. Many conditions can cause them, but magnesium is common enough, important enough, and overlooked enough that it deserves attention. The form matters. Magnesium glycinate is often better tolerated by the stomach and is a good option for people who are sensitive to loose stools. Magnesium citrate can also be useful, and it brings citrate along with it, but it can loosen the bowels, especially at higher doses. Magnesium oxide is common and inexpensive, but it tends to be less well absorbed and more likely to act like a laxative for some people. The label also matters because magnesium 500 milligrams does not always mean 500 milligrams of elemental magnesium. You want to look for the elemental magnesium amount when choosing a dose. For many older adults, the safer approach is to start low. Later, I will give you a practical range, but the principle is simple. Do not start at the highest dose on day one. Your goal is not to overwhelm your gut. Your goal is to support the body consistently. Now, magnesium helps the energy and repair side of the morning, but the next system is lower in the body, and it is one of the most important systems for healthy aging, the kidneys. Most people think of the kidneys only as filters. They imagine the kidneys removing waste and making urine. That is true, but it is incomplete. Your kidneys also help manage acid-base balance. Every day, your metabolism produces acids. Protein metabolism produces acid load. Exercise can produce lactic acid. Carbon dioxide from normal metabolism interacts with the body's buffering systems. Your blood pH is tightly controlled, because even small changes in blood pH can be dangerous. One of the major buffers involved is bicarbonate, and the kidneys help regenerate and conserve it. As we age, kidney function often declines gradually. That does not mean every older person has kidney disease. It means the kidneys may have less reserve than they did at 30 or 40. A system with less reserve can still function beautifully, but it may become more sensitive to dehydration, high sodium intake, uncontrolled blood pressure, diabetes, certain pain medications, and chronic acid load. This is why I do not like the phrase kidney reset. It sounds exciting, but it is misleading. You do not reset kidneys with a drink. What you can sometimes do is support kidney workload, hydration, and urinary chemistry. That is a more honest and more useful goal. In people with chronic kidney disease and metabolic acidosis, bicarbonate therapy has been studied and is sometimes used under medical supervision. But that does not mean everyone should start taking baking soda every morning. Medical bicarbonate therapy is about the right patient, the right lab values, the right dose, and monitoring. The same substance that can help one person may worsen fluid retention or sodium load in another. So the question is not, is bicarbonate good or bad? The question is, for whom, at what dose, and under what conditions? That is the difference between internet advice and responsible medicine. And this is where lemon becomes more than flavor. Many people think lemon water is popular because of vitamin C. Vitamin C is useful, but it is not the most interesting part of lemon in this routine. The more important compound is citrate. Citrate can influence urinary chemistry. In the urine, citrate can bind to calcium, making calcium less likely to form crystals. This is one reason citrate has been studied in the prevention of certain calcium kidney stones. Potassium citrate, in particular, is used medically for some patients who form recurrent calcium stones and have low urinary citrate. Fresh lemon juice is not the same as prescription potassium citrate. I want that distinction clear. But fresh lemon can provide citrate. And for some people, increasing citrate intake through citrus may support a healthier urinary environment. That does not mean lemon flushes the kidneys. It does not mean lemon reverses kidney disease. It means citrate may help make the urine less favorable to certain calcium crystal formation in appropriate people. There are practical details that matter. Fresh lemon is preferable to bottled lemon juice when possible, because bottled juice can vary in quality, processing, and freshness. Half a fresh lemon is a reasonable starting point for many people, but the exact citrate amount varies by the size and ripeness of the lemon. Do not obsess over pretending every lemon is a lab-measured dose. Think of it as a consistent, food-based source of citrate. Your teeth matter too. Lemon juice is acidic before your body metabolizes it. If you sip lemon water slowly all morning or brush your teeth immediately afterward, you may increase enamel irritation. A simple way to reduce that risk is to drink it in a reasonable time. Use a straw if your teeth are sensitive. Rinse your mouth with plain water afterward, and wait about 30 minutes before brushing. Now we need to discuss the ingredient that creates the most curiosity and the most risk: baking soda. Baking soda is sodium bicarbonate. It can neutralize acid. That is why people have used it for indigestion, and why bicarbonate has medical uses in specific situations. In the context of this routine, a very small amount may contribute bicarbonate and may help shift urinary chemistry in some people. But the word sodium is important. Sodium bicarbonate contains sodium, and sodium matters if you have high blood pressure, congestive heart failure, swelling in the legs, kidney disease, or a doctor who has told you to restrict salt. This is where many online videos become unsafe. They act as if baking soda is harmless because it is in the kitchen. But a kitchen ingredient can still affect your body chemistry. Too much baking soda can cause nausea, bloating, sodium overload, changes in potassium, metabolic alkalosis, and dangerous problems in vulnerable people. More is not better. Daily is not right for everyone. And if you are already taking medications that affect your kidneys, electrolytes, or heart rhythm, you need medical guidance. For a generally healthy adult without kidney disease, heart failure, uncontrolled blood pressure, sodium restriction, or interacting medications, a tiny amount may be tolerated. But I would rather see someone start with 1/8 teaspoon than jump straight to 1/4 teaspoon. 1/4 teaspoon of baking soda is roughly around 1 gram, depending on the product and how it is measured, and that can contain roughly a few hundred milligrams of sodium. That may not sound like much for one person, but for another person with fluid retention or a strict sodium limit, it may matter. So before the recipe, we need to address the most sensitive word around this topic: cancer. You may have heard people say that alkalinity starves cancer. That phrase is attention-grabbing, but it can become dangerous if it is not explained carefully. Here is the honest science. Many cancer cells show altered metabolism. The Warburg effect describes how many cancer cells rely heavily on glycolysis, even when oxygen is present. This can contribute to an acidic microenvironment around tumors. That acidic environment may affect immune cell activity, tissue invasion, blood vessel formation, and how certain treatments behave inside the tumor environment. That part is real biology. Tumor acidity is a legitimate research area. Scientists have studied whether modifying pH signals or the tumor microenvironment could influence cancer behavior or treatment response. But that is very different from saying that drinking lemon water and baking soda cures cancer, prevents cancer, or makes cancer starve in your body. It does not. No responsible physician should tell you to replace oncology treatment with an alkalizing drink. Your blood pH is tightly regulated. You cannot simply drink something and safely make your blood alkaline in a dramatic way. If your blood pH changes too much, that is a medical emergency. What food and fluids can influence more realistically is urine chemistry and some metabolic signals, not a magical anti-cancer state. So if you currently have cancer, have had cancer, or are receiving chemotherapy, radiation, immunotherapy, hormone therapy, or targeted therapy, the right person to ask is your oncology team. Some supplements and alkalizing agents can interact with treatment plans or change how your body handles medication. The biology is interesting, but interesting biology is not the same as treatment. Real medicine becomes dangerous when a mechanism turns into a miracle promise. I want you to understand the mechanism without being misled by the exaggeration. Now that the science and the limits are clear, here is the practical morning routine. When you wake up, before coffee and before breakfast, prepare 400 to 500 milliliters of water. That is about 14 to 17 ounces, or roughly 2 cups. Room temperature or slightly warm water is usually easiest on the stomach. Ice-cold water is not forbidden, but some people with reflux, swallowing sensitivity, or stomach discomfort tolerate room temperature better. Add the juice of half a fresh lemon. Stir it in. If your teeth are sensitive, use a straw and rinse with plain water afterward. Then, if you are an appropriate person for sodium bicarbonate, add a very small amount of food-grade baking soda. I would start with 1/8 teaspoon, not 1/4, especially if you are new to this. Stir until it dissolves. It may fizz when it reacts with lemon. That is normal. Then consider magnesium, but do not treat this as mandatory for everyone. If you already take magnesium at night and it works well for you, you may not need to move it to the morning. If magnesium makes you sleepy, evening may be better. If your goal is to support the morning fasted window and your doctor agrees, you can use magnesium in the morning. A conservative starting range for many adults is 100 to 200 milligrams of elemental magnesium. Glycinate is often gentler. Citrate may be useful but may loosen stools. If your bowels become loose, reduce the dose or change the form. After drinking it, wait 20 to 30 minutes before breakfast if that is safe for you. This gives your body a little time to rehydrate before digestion begins and allows the fasted morning window to continue briefly. But if you have diabetes and are prone to low blood sugar, if you are frail, if you take medications that must be taken with food, or if your doctor has told you to eat at a specific time, follow your medical instructions first. A YouTube routine never outranks your actual medical plan. The order is simple: water first, lemon for citrate, optional tiny bicarbonate only if appropriate, magnesium only if appropriate, then wait before coffee and food. Do not make it stronger. Do not take baking soda several times a day because you think more alkaline is better. Do not combine it casually with medications. Do not use this to treat symptoms that require evaluation. And there are 5 mistakes I see people make with routines like this. The first mistake is starting too high. They take a full dose of magnesium, too much baking soda, extra lemon, and then wonder why their stomach is upset. Your body does not reward shock. Start low. Let your gut and your routine adapt. Consistency beats intensity. The second mistake is skipping the lemon but keeping the baking soda. Lemon is not just for taste. The citrate is one of the most useful parts of the routine for urinary chemistry. If you cannot tolerate lemon because of reflux or dental sensitivity, do not force it. But do not pretend the routine is identical without it. The third mistake is eating immediately afterward. If you drink the water and then 5 minutes later eat a full breakfast, you may still benefit from hydration, but you lose some of the timing advantage of the fasted window. For many people, 20 to 30 minutes is enough. You do not have to fast until noon. This is not extreme fasting. It is simply giving your body a quiet start. The fourth mistake is taking it with medications. Magnesium can bind to certain antibiotics, including tetracyclines and fluoroquinolones, and reduce absorption. Minerals can also interfere with some thyroid medications and osteoporosis medications. Bicarbonate can alter stomach acidity and may influence how certain drugs behave. If you take morning prescriptions, ask your pharmacist or doctor how far apart to separate them. That one question can prevent a serious mistake. The fifth mistake is expecting dramatic results in 48 hours. Hydration can make you feel better quickly. Urine color can change quickly. If you are low in magnesium, cramps or sleep quality may improve over weeks. Blood pressure or glucose patterns, if they change at all, usually change gradually and depend on many other factors. Kidney protection is not something you feel overnight. It is a long-term direction, not a quick sensation. Now, before we close, this safety section is not optional. If you have known chronic kidney disease, especially stage 3 or worse, do not start adding bicarbonate or magnesium without your clinician's guidance. If you have stage 4 or stage 5 kidney disease, or an eGFR below 30, magnesium supplementation without supervision can be dangerous, because impaired kidneys may not clear excess magnesium well. If you have congestive heart failure, swelling in the legs, uncontrolled high blood pressure, or a sodium restriction, do not add baking soda without asking your doctor. If your potassium runs high, or you take ACE inhibitors, ARBs, spironolactone, eplerenone, or other potassium-sparing medications, you need to be careful with anything that changes electrolytes, including citrate strategies. If you take lithium or digoxin, this routine requires medical supervision because electrolyte and kidney changes can affect drug levels and toxicity risk. Seek medical attention if you develop unusual muscle weakness, confusion, irregular heartbeat, sudden swelling, severe shortness of breath, flank pain, or blood in the urine. And if you already have symptoms like persistent fatigue, unexplained weight loss, severe thirst, very frequent urination, or worsening swelling, do not cover them up with a morning routine. Get evaluated. The big message is not that one drink changes your life overnight. The message is that the first 30 minutes of your day matter more than most people realize. After 60, your body is still incredibly capable, but it benefits from rhythm, hydration, minerals, and respect for its limits. Morning water can help you begin the day with less strain on the system. Magnesium, when appropriate, can support the energy machinery, muscle function, nerve function, and normal repair pathways. Fresh lemon can provide citrate that may support healthier urinary chemistry, and a very small amount of bicarbonate may be useful for the right person, but it is not for everyone. This does not cure cancer. It does not reverse kidney disease. It does not replace your doctor's treatment. But for the right person, done carefully, it may be a simple way to support the systems your body already uses every morning: hydration, filtration, energy balance, and cellular maintenance. I want you to leave with a practical plan, not fear. Tomorrow morning, before coffee, notice your body. Is your mouth dry? Is your urine dark? Do you rush straight into caffeine? Do you take medications with barely any water? The first change may be as simple as giving your body 2 cups of water and a few quiet minutes before demanding performance from it. If you want me to make a simple 7-day morning routine for people over 60, comment the word water below. And if you know someone who wakes up and drinks coffee before water every single morning, share this video with them. It may help them rethink the first 10 minutes of their day. Subscribe to Dr. Caleb Rowan for more clear, practical, science-based guidance on aging with strength, independence, and confidence. I will see you in the next video.